Hi.
Good morning.
How are you? Hi, honey. How are you? Good to see you guys again. You can sit down over here. If you want to take a seat up there. I'm just looking at the last clinic note when we saw you guys in June. Anything major since then? Any ER visits or any hospitalizations?
No.
Okay. So my personal background with diabetes is very significant. My dad had type 2 diabetes. He is one of 12 children, and all of his siblings have diabetes, unfortunately. And he actually passed away from type 2 when I was 12. He was 52. And then when I was in medical school, I really decided I wanted to treat children. I think that's what naturally led me down the path of becoming a pediatric endocrinologist.
Working with Dr. Swami has been phenomenal. She's very personable. She has a great bedside manner. She's very concerned, but she's also stern, and she wants results from him, and she holds him accountable and responsible for what he needs to do for his care. I feel like I'm part of a family here. You know, we come here and I feel like she cares about him like he was a member of her own family.
Nice work.
Our program is certified by the American Diabetes Association for our education program. It's called Education Recognition. And what this means is that our program meets the standards of care for education. Education is important in order for you to be able to do your diabetes care. You have to know what you're doing. What you know, what you feel, what you think, all of this affects what you do and your behavior. And 99% of diabetes care is what you do. So our program is geared towards making sure that our patients get the very best education possible. And then after you practice for a few days, you'll come in for your group training.
Okay.
Where you'll be with another family, another child who's starting their pump.
Right.
And that's where you'll start using the pump officially, where you'll put insulin in it.
There are certain foods that will raise blood sugar levels, and those are the foods that have carbohydrates. So carbohydrates, in simple language, are just sugars, because what happens is when we eat foods that have carbohydrates, they will be digested to glucose, and glucose is the sugar in the blood that we measure.
And then down arrow to 7.5, and press X. You're done. See, you know how.
Okay.
How about, you want to try the basals? When you're certified, you need to have a multidisciplinary staff, which includes nurses, dietitians, social workers, psychologists, and physicians. And all of these people are certified in pediatrics and pediatric diabetes education. Together, we work to help create a plan that's individualized. Another part of recognition is that you have a one-on-one assessment period with the patients. We spend a long time getting to know you so that we can prescribe for you what will work best for you and your family.
Dr. Swami's whole team approach is awesome because she has the dietitian, the psychologist, and she has 4 or 5 nurse practitioners that work with her. You meet with each of these people and they do help you in the care of your child. I mean, it's awesome because there's so many things that are involved with diabetes.
And we're going to look at all your information. So let's look at the next screen, okay?
The nurse practitioners are great because we do call there often and they call you back that same day. You can download the pump at home, the information from her pump, and they can pull that up at their office and look at it and kind of help you to make adjustments and different things like that for it. It's great.
The multidisciplinary team entails our psychologists who are critical in addressing their mental health needs.
What's been the hardest part for you, Hudson?
Probably taking insulin and...
We want to get a clear picture of what's going on for the child and what is contributing to the fact that they're having a difficult time with either adjusting to the diabetes or really just living with it in an ongoing way.
In addition to that, we have social workers who are outstanding, so if there are any issues with resources or school-based care, they can address that.
You have to go to the bathroom a lot?
Yeah. And sometimes I'm hungry before snack.
You're hungry before snacks too, okay.
And in addition to that, I have our nurses and nurse practitioners and advanced practice nurse who are all educators. So there is an entire team that makes this run very smoothly.
Can you open your mouth and show me your tonsils?
Good job. One of the most challenging things is that we expect the families to do most of this care themselves at home. So the mainstay of the therapy is actually the education and enabling and empowering the families to learn how to take care of it themselves. Once a year, we have a big seminar. We did a talk on all of the research updates in diabetes. We talked about how to transition from pediatric to adult care, vitamin D and what it means when you have low levels, high cholesterol and diabetes, so lots of wonderful and different topics. We had a family panel where families could just share their experiences. I think this is extremely well received as well and something that's needed.
An important part of our program that we offer to our families is access to care. We have outreach clinics that we go to in the community so that families can meet their requirement or they can have their follow-up appointments quarterly without having to miss the whole day of school or a whole day of work. In between visits, we have an 800 number that allows our family phone contact with us 24/7. So if there's an emergency, you're able to reach a provider or a diabetes specialist within minutes. If you have a routine question, our nurse specialists staff the routine call line on a daily basis, and we get about 1,000 phone calls a month from our families that call in for help.
Es muy común en esta edad y vamos a ver lo que está comiendo. The first thing I tell them at diagnosis is this is not your fault. You didn't make this happen. It just did. And the second thing is they're going to be okay with the right guidance and I think some hope and fortitude. They're going to be just fine, and this child is going to lead a very active, healthy, and normal life. So I truly feel that in my lifetime, we will have a cure or an artificial pancreas by then, and their lives will be entirely different than they even are today.